Friends. Till now we have seen the introduction part of the oncology, isn't it? So, what is normal cell? What is cancer cell? Today we will see the your examination part. Okay. So, what is oncology? Branch of medicine that deals with the study, detection, treatment, and management of cancer and neoplasia is known as cancer. Okay, oncology, study of medicine. It is also one of the branch for the medicine like cardiology, pneumonology, rheumatology, same like that. Ophthalmology, isn't it? Is also one of the branch of the medicine. Oncology deals with the study and detection and as well as treatment part of the and management part of the cancer and also neoplasias. That means any cancer related things. I told you, no, cancer is of two types, benign and the malignancy. So cancer, they are having, they will be available in so many names and so many forms. That means according to the origin they are given one name, according to the structure they have given one name, according to the substance that are present in the cancer cell they have given the name. So that they may be benign, they may be malignant. So that study of everything and treatment part, management part, detection part is known as branch of oncology. So now coming to the root words. Here in this unit you will find out some new words. Okay, root words. That means which is different. Till now you did not see these words. Only especially to the oncology topics only you will see this type of specific words. What are those specific words? Neoplasia, new cells. Plasia means growth, new growth, neoplasias. That means new growth in the body. Plasm, substance. Trophy, size. What is a trophy? If you see the CT, X-ray or scanning of a cancer patient, you can see this. The trophy they will give not only cancer patients. If any time if you get infections, no, they will do liver scanning, RFTL. That time also imaging of your thing, you will see this word trophy. Trophy means size. And oma. Anywhere you get oma, it is tumor, whether it may be malignant or it may be benign. Oma related to the sarcoma, carcinoma, so it related to the tumor. The next thing is stasis. Status means nothing but confined location. Stasis or status both are same. It is nothing but related to one region. Okay, that means it confined to only to the breast, it is confined only to the stomach part, it is confined only to the duodenum part, like that. So location, exact location of the tumor. And A, none or absence. Any word A will come in this unit will related to the absence or none. Ena, lack of the things. Anorexia, lack of hungriness. Okay, like that. Uh, and hyper, excess. Hyper, you all know, excessive. Meta means changes. And dysplasia, dearrangement of cells, otherwise irregular arrangement of cells. These are about the root words. And already you know what is characteristics of neoplasia. That means new growth. Already told you, neo means new, plasia means growth. So the new growth in the body, uncontrolled growth in the body will be seen in the type of three things: benign, malignant, borderline. Benign in the sense it is a confined to a small area which can be treatable. And malignancy, it is a confined to a large part, it can be transferred to other parts in the body which cannot be very difficult to treatable. Borderline means you may get the cancer because of your body tumors, you may convert it into a cancer. That is borderline. So based upon how the characteristics of neoplasia looks like, ante three types. It may be a benign, it may be a malignant, or it may be a borderline. So what is benign? If you see here, benign, it is well differentiated. So if you see the cancer cell yesterday, it is uncontrollable and it doesn't have any shape. It can travel to anywhere, isn't it or not? But while coming to benign, it cannot travel to anywhere. It is well differentiated and it is present separately. You can see nicely in the microscopic structure. Slow growth will be seen. encapsulated will be seen, and non-invasive, it cannot invade to other parts of the body, and it also does not metastasis to bloodstream or lymphatic stream. ఓకే, ఎక్కడ ఉంటే అక్కడే ఉంటుంది. ఇఫ్ యూ ఆర్ డిటెక్ట్ ఎనీ ట్యూమర్ యూ క్యాన్ రిమూవ్ ఇట్, బినైన్ యూ క్యాన్ remove it through surgery. And coming to malignancy, it is uncontrollable, undifferentiated, it doesn't have any shape or structure, abnormally very fastly it will grow, and it will invasive, it will expansive, ekkadikaina it can go through the body. So it can secrete abnormal proteins, and also it is metastasis to all over the body. See how it looks like. If you see bloodstream, it is going. See that this is the cancer, is they have given nice tumor, isn't it? So how it is nicely going to the bloodstream, so wherever you want it will go. And bloodstream cancer cells, see how nicely it is going, invading. Okay. And what is nomenclature of neoplasia? So neoplasia means new growth. What is nomenclature? For that new growth, we are putting some names. That is known as nomenclature of neoplasia. Tumor is named according to the different types anamata. The first thing is parenchyma, or an organ or a cell. So manam ganka cancer, if it is getting to an organ, then how it called as? If a organ involved, that is liver, then it is known as hepatoma. Oma means cancer. Okay. Bone, osteoma. Muscle, myoma. Isn't it? So tumor named according to their structure that is seen under the microscope. Okay. The first thing is, if it is related to the organs, we have given names according to the structure it is seen in the microscope. That is, if the tumor is filled with cystic fluid, then it is called as cyst. If it is only a dead cell, granular cells, then it is known as adeno. It is a finger like projection cells are there, it is known as papillo. If it is a stalk, that means a small round tumor, okay, confined to one area, it is known as stalk. If it is like a stalk, then it is known as polyp. These are the names given according to their microscopic gross structure. And next thing is tumor according to their embryonic origin. So normally we have, our body has consisting of three layers: ectoderm, endoderm, mesoderm. So ectoderm is the outermost layer, endoderm is the innermost layer. In between ectoderm and endoderm we have a connective tissue layer, that is known as mesoderm. ఓకే. సో ఇది ఎక్కడైతే బర్త్ ఆఫ్ ఆరిజిన్ ఉందో, దెన్ వీ కెన్ గివెన్ ద నేమ్స్. ద ectoderm and the endoderm, usually we call it as give rise to a oma. So adipose tissue, lymphoma. Bone tissue, osteoma. Blood vessel, angioma. Fibrous tissue, fibroma. If named according to embryological thing, ectodermal, endodermal, granular, epithelial, whatever the thing, unless all these things, endoderm, ectoderm, glandular cells, everything we call it as carcinoma. But if this malignancy tumor is present in connective tissue, then it is known as sarcoma. ఓకే, మీసోడర్మల్ ఆర్ కనెక్టివ్ టిష్యూ. సో మిడిల్ లేయర్లో ఉండి కనెక్టివ్ టిష్యూలో ఉంటే కనుక వీ కాల్ ఇట్ యాజ్ సార్కోమా. ఇఫ్ ఇట్ ఈస్ ప్రెసెంట్ ఇన్ ద అవుటర్ లేయర్ అండ్ ద ఇన్నర్ మోస్ట్ లేయర్, దెన్ ఇట్ ఈస్ నోన్ యాజ్ కార్సినోమా, sarcoma, lymphosarcoma, like that it will be given names. So oma, malignant, you all know that. Hepatoma, liver cancer. Lymphoma, lymphatic cancer. Glioma, melanoma is cancer to the melanin cells in your skin. And 3 germ layers. Teratoma, if it is any 3 layers are involved, then it is known as teratoma. Non-neoplastic, but oma is nothing but hematoma, choristoma. So these are the non-neoplastic. Neoplastic means new growth. Non-neo growth cells are known as oma, but these are cancer. Okay, new growth will not be seen in that area. They can అక్కడ ఉన్నది కొంచెమే ఉంటే ఇట్ స్టేడ్, బట్ ఇట్ కెన్ ట్రాన్స్ఫర్ టు అదర్ పార్ట్స్. ఓకే, సో న్యూ గ్రోత్ విల్ నాట్ బి దేర్, బట్ ఇట్ ఈస్ ఆల్సో ఏ క్యాన్సర్, దట్ ఈస్ హెపటోమా. బికాస్ hematoma in the blood, always the cancer will be in a moving way. isn't it? Okate దగ్గర it cannot stay there and it cannot grow into newer size. But they have a cancer cells in the blood, it cannot replicate, it can transfer to other parts, it cannot form like a big tumor and obstruct the circulation, isn't it? So that is known as non-neoplastic but cancer, oma, hepatoma and choristoma. Then review of normal cell cycle. So how this normal cell cycle looks like? So there are three types of normal cell cycle. Permanent cells, there is no cell division, that is cardiac and the neurons. And stable cells which has a resting, always they will be in a resting cells, that is kidney and the liver. And label cells, always there will be a working, dying, and new cells will be grown, that is GI tract, skin, endometrium, and the blood cells, more working cells anamata. So this is the cell cycle, how these are transferring. So G0 dominant, Z1 normal cell activities, S DNA synthesis, G2 it is for cellular division, M is for meiotic phase. So these are the IPMAT. This is the cell cycle, how it undergoes. Okay. Then proposed molecular cause of cancer, change in the already yesterday I have told you that mostly the cancer will be formed because of the DNA and RNA abnormal replication of the cell. Okay, more abnormality in the DNA strands and the RNA strands will leads to the cancer. So what is etiological of cancer? What are the causative factors of the cancer? If you take the causative factors, the first thing is the exact known we don't know for any for cancer, but we have so many risk factors. In that, first thing is physical agents. Physical agents may be radiation. If you are more prolonged thing to the radiation, like what is this radiation, you know that cellular towers, your mobiles, your TV, everything, satellites, so these all will have some radiations. If you are exposed to that radiations, because why nowadays everyone is getting thing ante, every in the areas we are having cell towers, isn't it? So mostly they are big buildings they are selecting and they are putting these things. And exposure to irritants, exposure to sunlight, altitude, humidity. At altitude and humidity, nothing but climatic changes also will be causes for the cancer. And chemical agents includes smoking, dietary ingredients, and drugs. Okay, smoking you all know, drugs you all know, dietary ingredients are nothing but fatty foods and hot spicy foods, hearty foods, canned foods. Okay, this all leads to the cancer. Genetic factors, this is very much important because 90% of the cancers will get because of our genetic. So our parents are having definitely chances to get for the children also. And also premenopausal breast cancer, and that means before menstrual cycle only, if anyone is having breast cancer, no, they are the chances to get again after menstrual cycle. And next thing is dietary habits, lower fiber diet, high fat diet, processed foods, and alcohol taking. And also some virus and bacteria, repeated exposure to virus and bacteria also will get the cancers. And hormonal agents, I told you, so many people will take tablets for pregnancy and for not to get pregnancy, and PCODs, hormonal tablets they used to take, so those people also will be risk for getting cancers. And estrogen origins, so estrogen they will take, so that people will get the thing. And immune diseases, some of the immune diseases also will lead to the cancer, something AIDS. Okay. And carcino, how it is a normal cell is transferred into a malignancy cell, carcinogenesis, how it is transferring. There are three processes, that is initiation, promotion, and progression. So first, in the initiation process, what is happening, the cells, what are the cells that are going to be cancer, that are changed to be cancer? The first thing is they will have changes in the DNA, altered DNA will be seen. So for these things, the cells will be first, they will be repaired, or sometimes they will be die because of this DNA. So next thing what happened, some cells will be dying and some cells will be repaired and some cells will have the altered DNA. So these cells will be get promotion. So they will be exposure to carcinogens repeatedly. The DNA, RNA will selfly it will get, and they will this period, no, that process, it is growing slowly, it is growing into a cancer cell. That period is known as latent period, which is second stage, maybe first and second stage. And finally progression, it will be increasesly, it will be rapidly, it is increasing its size and cell division will be seen. So spread of cancer, you all know how it is spreading from one part to other part. Mostly we have two types of drainage system in our body. One is blood flow and next thing is lymphatic flow. So through these two things only, this cancer cell also will directly spread. So this through channel it will go, otherwise directly also nearby it will invade, because the malignancy cancer can have the can invade to other parts. So from one part to other part it may invade. And body defense, see anything, if any bacteria, if any virus it is entering, our body will have our own good immune system. So if like that only, if cancer cells enters into our body, how our body will protect body defense against tumor. So T cell system, you all know that our body is having T cell immunity system. So if it is strong, it can fight with cancer cells. B cells are there, if that is also, that is known as humoral immunity. So it can produce antibodies against this cancer cell. And next thing is phagocytic cells. So in our cell, each cell is having phagocytes which can kill the poisonous things or poisonous material. Sometimes if you are good healthy, if you are good enough healthy, then these phagocytes will kill and eat all the cancer cells. Now how the cancer is diagnosed, these all are the assessment part. So how can be diagnosed, and so how it is diagnosed, you all know there is only one diagnostic, specific diagnostic procedure is there, that is biopsy. So what is biopsy? Taking a small tissue from the tumor and sending to the laboratory is known as biopsy. So then you can know whether it is malignant or benign. So next thing is CT and MRI scan, and you can detect any tumor markers in the body. And you know that cancer grading, it is grade 1 to grade 4. Grade 1 is a low grade and grade 4 is the high grade cancer. So now cancer staging is there. So according uses the TNM staging system. So what is this TNM staging system? The first stage, one classification is 1 to 4 stages, isn't it? First stage, second stage, third stage and fourth stage. Then coming to other staging system, TNM. T, tumor, only confined to one area. Node, it is transferred to nodal area, nearby nodal region. Third, it is metastasis to all over the body. That is TNM. Tumor, node and metastasis. You have to remember all these things, because you may get short answer like write the classification of tumors. So you have to write stage 1 to stage 4 one type, and this is TNM staging or classification. Now coming to the medicine part, here they have given you the medical part first. So here medical part: surgery, control, palliate, chemotherapy, radiation therapy, immunotherapy, bone marrow transplantation. So what is chemotherapy? Chemotherapy is nothing but giving a large number of medicines in a large dose in at one bowel, అంటే one saline. ఓకే, మొత్తం అన్ని మెడిసిన్స్, పవర్ఫుల్ మెడిసిన్స్ అని వన్ సెలైన్ దే విల్ ఎంటర్ అండ్ దే విల్ పుట్ ఇట్ ఆన్ టు ద cancer body. Because of this high medicine power, it will go and kill the cancer cell. Radiation, you all know, through the UV rays they will kill the cancer cells. And immunotherapy, you can give IgG, like that you can give injections. Bone marrow transplantation, if it is related to any bone cancer or any blood cancer, then you can do this bone marrow transplantation. And general promotive preventive nursing management includes, so lifestyle modification should be there, nutritional management, screening, and early detection should be there. So lifestyle modification, you all know healthy lifestyle should be there, and screening. Every male and female should go and do blood tests at least yearly once. Okay, otherwise if your mother is or your family is having this cancer history, then definitely yearly once you have to go and do the checkup. And we have self checkups like breast self examination, and for the boys you have testicular examination. That two parts you will see, we will see in the next class. Okay. And coming to the warning symptoms, see, these are the signals or the signs and symptoms for the cancer patient, that is caution. So CAUTION. This is very much important question for you. 5 marks question. What are the signs and warning signs of cancer? Five things. C. Change in the bowel and bladder. That means your toileting will be changes. A. Sore that doesn't heal. Sore means wound. అది ఎప్పటి హీల్ అవ్వదు. And U, unusual bleeding from vagina or any cuts. You will see the unusual bleeding. T, thickening or lumping in the breast. Indigestion. And obvious change in the warts. Warts are nothing but like birthmarks only. You will have bigger one, blacker one on your face sometimes, no? Pulipirlu you call it in Telugu, Hindi, I don't know. So that is, you have seen more warts on your body, and nagging cough and the hoarseness on your voice. And assessment again, along with this caution symptoms, you may have other symptoms like weight loss, frequent infections, skin problems, pain, hair loss, fatigue, disturbances in the body image can be observed in the thing. And see, because of this cautions, signs and symptoms, and because of this treatment, no chemotherapy, radiation, the person will have um, some problems. The first thing is skin problems. Because of this high drug power, the skin integrity will be lost. So that time what you have to do, smoothly, gently you have to take care of the skin. Do not rub the affected area. So lotion should be applied on the skin, and also you have to wash the skin with soap and water. And because of this power, no, these patients will get stomatitis. That means inflammation, redness, sore throat under sore mouth. You will get a red color mouth and tongue, and your area, no, buccal area will be become red. That is known as stomatitis, inflammation of the stomal area of your mouth. So that time you have to see that. And toothbrush, soft toothbrush should be there, and also frequent rinsing should be there of your mouth. And you can use, otherwise you can use a mouthwashes. Now ready madely you are getting no Listerine, like that Colgate, you can use it and eat before eating. And management of alopecia, so we can't do anything because of this treatment. You all know, the because of, you have seen so many cinema actors, no, if any cancer they detected, they will shave their head. So why? Because ante they have severe alopecia, so in order to overcome that, they will be removing the hair. And also, see, this is removing the hair is for the boys, it's okay. For the gents, it is okay. But while coming to women and the females, no, it is a very difficult one to remove the hair. So, because it is a traditional part of the body, isn't it? We can't accept, we can't see without hair. So, they may have lots of mood depression or any depression, like whether they will get hair or not later. But after the treatment finish, no, slowly the hair will grow. But as a nurse, you have to explain them clearly, and you can encourage them to use hats and the scarves, and also you have to tell them all these things. And promote nutrition, because these people will be staying more time in the hospital to take the treatment, 10 chemo, so they will be in the hospital only. So for that, no, you have, as a nurse, you are getting more chance to give care. The first thing and next thing is, you have to give good nutrition for the patient, frequent small meals, and what is that, high fiber diet, high liquid diet, that all you have to be given. Because of vitamin supplements you have to give, and oral hygiene should be there. And because of these street drugs, no, they will be having severe pain. So for the pain also, according to the pain, moderate, severe, mild, you have to administer the medications, analgesics. and you have to decrease the fatigue. You have to encourage them little activity and good food, good meals, and resting period should be given. So improve body image. So it is like nothing but you can tell them to offer wig for hair loss, okay, and you can do makeup, like that you can make them self, encourage them independently, you can do yourself. So by see, if you see now videos also, most of the cancer heroines, they'll do makeup, they put wig, and they will do all these things. No, they can do with family, they will go out with the family. All the things you have to encourage them to do in their life. And last thing is assist them in the grieving process. It is more important, because as a nurse, they are cancer patient. Cancer is a, they know that cancer is a very serious problem. Most of the time survival chances are less, so there will be more grieving sad process. So you have to be with them, and you have to encourage them all the positivityness in them, and also you can clear the doubts of the patient, and you can tell the treatment that is available, and manage the complications like infection. They are more frequently they'll get infections, so don't allow them to outside. If any infection is there, priorly you have to administer antibiotics, and you should not, you should avoid the outing, and you should any surgeries also have to avoid them. And you have to manage the complications also by monitoring your bp, everything vitals, and administering antibiotics. Sometimes if it is serious, no, you can administer them the O2 also. See if any bleeding is there, or if you see any thrombocytopenia, decrease platelets, and you have to see all these things in your mind. So use soft toothbrush, and use electric razor for the shaving. Avoid frequent IM, IV, or any procedures, and the soft food stool softener should be given. This is about the cancer. And next class, see this oral cancer and everything, that colon cancer, that will be dealt by Yamini madam. I am going to start you the second unit, okay, related to your breast problems. Now in this first unit introduction part, two topics are left over, that is breast self examination and testicular examination, that I will be taken in the next class. Okay, bye guys.